This video, we'll do a mock case investigation interview to see what a realistic scenario could look like for the case investigation form in the Dr. Justina application. In this video, I'm logged in as a case investigator, and I've proceeded by looking in the All Cases module, searching for a particular case named Josh Blue, and then proceeding to the case investigation form, which we will do a mock walkthrough of in this video. You'll see at the top of the form, it says Josh Blue has not yet been deduplicated. So this is a warning to us that we'd want to make sure to actually use this identified duplicate patient form to confirm that we don't already have a record for this patient. But since we're not focusing on that form here, I'm just going to proceed. At the top of the form, we see a helpful patient information summary where we can see some of the key information about Josh. So here we can see Josh's name, the date of birth, and when the case was opened, among other things. Some of these are not yet filled out because we haven't yet collected that data, but we will do so in this interview. We would also potentially see information of which variant pertained to the case if any lab testing had revealed that. So before we go ahead and call the case, we want to just take a look at some of the basic information. So we see the name, date of birth, and then that it is a confirmed case. If this were a confirmed case coming in from Cedars, they would have a lab result associated. I just manually created this for the demo, so we see this here, but normally a confirmed case would have an associated positive lab test result. And here there's a reminder to the interviewer that we should identify ourselves and confirm that we've contacted the correct person, confirm their details, and figure out whether they already know they've been infected or not. And here we see the option to complete a full or a brief interview. So here we're going to do the full interview just to be the best example. But if you select brief, which is sometimes that's all we need, then you would not see quite as many questions. So quickly, we will also look in the notes section. We can view any past notes that were created for this patient. We can see the most recent note at the top, or we can add a new note. So here, I could add a note like first interview and proceed from there. Okay, so now we could also see past contact attempts. There's nothing here since no one has interviewed this case before, but we want to go ahead and record a new contact attempt before we reach out to them. So you'll see your name and today's date auto-populated. This is a required field that we'll come back to later, depending on how the interview goes, whether we're able to reach them and conduct the interview. We're going to do a phone call to try to reach Josh today, and we'll contact the case himself, although sometimes if it's a child, for example, we might contact the parent or guardian. And you can also specify the process under which the case was first identified. We can also look in the patient information section and see some other basic information, which we're going to go ahead and confirm with the case when we call him. So we see some instructions here, and then a script for if we go to a voicemail, otherwise a script for calling the person up. And so now I'm going to go ahead and commence the interview. I'm going to scroll back up to find the phone number and then call Josh. Oh, here we don't have a phone number, but let's pretend we do. Normally you'd have one already coming in. So I'll call the phone number that would be listed up there, and I will begin my call with Josh now. Hello, this is Kate from your local public health authority. May I please speak with Josh Blue?
I'm speaking.
Oh, great, thank you. I need to discuss some time-sensitive health information with you before we continue. I just want to confirm your date of birth. Is it correct that your date of birth is 4/24 in 1990? That's
correct.
Okay, thank you very much. So we noticed that you have a positive lab test. So as a note to the interviewer, we would then read the script here talking about why we're calling, and then we would ask for any questions or concerns. But for the sake of this video, I'll proceed now to the patient information section. Okay, Josh, back to the phone call. I'd like to begin by asking you some questions about yourself. I want to make sure the information we have is complete and correct. Can you please tell me your preferred name and the pronouns by which you would like to be addressed?
I'd like to be addressed with he, him pronouns, and my name is Josh. But I'd like to go by.
Thank you.
Thank you.
Okay. And what is your preferred language?
Is English.
English. Okay. Do you have any other language, secondary language you'd like us to note?
I do not.
Okay, thank you. And now an important one is, can I please get your home or cell phone number? This should be the 10-digit number here.
816
Mhm.
123 4567.
Great, thank you. Before we move on, I'd like to briefly discuss our text message policies. And for the sake of this interview, I'm not going to read this whole thing in the video, but it talks about how they can opt in or out and gives information before we ask for their consent. So now back to the call with Josh. Josh, do you consent to receive SMS messages on this phone number that you provided?
Yes.
Okay, great, thank you. So you should be receiving a welcome message, assuming your LPHA is opted into that, as well as then a final survey at the end of your isolation period to check in on you. Is there any other work phone or another phone number you'd like us to have on file?
No.
Okay, and can I please get your email address?
It is joshblue
Mhm.
at email.com.
Okay, thank you very much. And I could also ask you for your WhatsApp number, although I think we're good with your phone number. So now I'll ask, in which county do you reside? Here in our, as a note for the video, we have only those in the testing domain, but our interviewee would be able to answer with the county they live in Colorado. Here, I'll just put staging for now, but we'd actually ask the case where they live. And I'll proceed now to the address field here. This is going to auto-populate the fields below, assuming that it's a valid address that we enter here. So back to the phone call. So Josh, can you please provide me with your home address?
Yes, it is 3201 East Platte Avenue, Platte.
Okay, in Colorado Springs?
Yes.
Great, thank you. And so now we can see these fields are populated. We have the city, state, and zip code. Great. Is your mailing address different than your street address?
It is not.
Okay, great, thank you. Now we're going to proceed to a clinical information section. For this next set of questions, it may be helpful for you to have a calendar in front of you in order to review some dates with me. It is important to be as accurate as possible with these dates. I'd like to start by asking you some questions about your illness. How are you feeling today?
I'm feeling all right. I may have a few symptoms though.
Okay, so I'm now going to ask you if you experienced any of the following symptoms once you got sick. There are many symptoms that I'm going to ask you, all of them, and to each you can reply either yes, no, or unknown or not sure. So first question is, have you experienced a fever?
Yes.
Okay, was that fever over 100.4 degrees Fahrenheit?
I'm not sure. I didn't take my temperature.
Okay, thanks. How about chills?
No.
Sweats?
No.
Dehydration?
Yes.
Sore throat?
No.
Runny nose?
No.
Stuffy nose?
No.
Loss of sense of smell or taste?
Yes.
Cough?
No.
Shortness of breath?
No.
Difficulty breathing?
Yes.
Wheezing?
No.
Chest pain?
No.
Abdominal or stomach pain?
No.
Okay, thanks for your patience. I'll ask you a handful of more symptoms now. Nausea or vomiting?
No.
Diarrhea?
Nope.
Body aches?
No.
Headache?
Yes.
Fatigue?
No.
Confusion?
No.
Persistent pain or pressure in the chest?
No.
Pale gray or blue colored skin, lips, or nail beds?
No.
An inability to wake or stay awake?
No.
And are there any other symptoms you'd like to note that we did not list above?
I don't think so. I think we got it covered.
All right, great, thank you. So based on that, we can tell that you are symptomatic here since you answered yes to some of the symptoms above. And have your symptoms resolved?
No, they have not.
Okay, you're still experiencing them. And what is the first date you experienced any of the above symptoms?
It was yesterday, the 26th.
Yesterday, the 26th. Okay, thank you. And what date did you get a COVID test?
I actually also got it yesterday.
Oh, great, right when you had symptoms. Good for you. During your illness, were you diagnosed as having pneumonia?
No,
And did you visit the emergency room while you were ill?
no, I did not.
Did you spend one or more nights in the hospital for any reason while you've had these symptoms?
I did not.
And have you been self-isolating during your illness?
No.
Okay, thank you. So now there are a few questions about your medical history that I'd like to review with you. These questions will help us understand who may be at higher risk of infection or severe illness from COVID-19. So I see here, I think we don't yet have your sex on file. So it's asking, before you were diagnosed with COVID, were you pregnant?
I was not.
Okay. Have you ever been diagnosed with any of the following conditions? Chronic lung disease, such as asthma, emphysema, COPD, or chronic bronchitis?
No.
How about cardiovascular disease?
No.
Endocrine disease, such as diabetes, hypothyroidism, Cushing's syndrome?
No.
Kidney or renal disease?
No.
Liver disease?
No.
Autoimmune disease?
No.
Hematologic disease, such as anemia or sickle cell disease?
No.
Any immunocompromised conditions, such as a solid organ transplant or HIV infection?
No.
Cancer?
No.
Disability or physical disability, intellectual disability, vision or hearing impairment?
No.
Any mental health issues or diseases such as depression, anxiety, or bipolar disorder?
Yes.
Okay. And any severe obesity, meaning a BMI greater than or equal to 40?
No.
And if you'd feel comfortable sharing, would you be able to specify the mental health disease that you've experienced?
Anxiety and depression.
Okay, thank you. This is just helpful for us to understand any additional risk factors. Are there any other chronic diseases that you did not note above?
No.
Okay, and do you take any medications that might weaken your immune system?
No.
And during flu season, we highly encourage you to get a flu shot. Have you received a flu shot since last August?
Yes.
Okay, great. And are you a current smoker?
No.
A former smoker?
No.
Do you use vaping products currently?
Yes.
And did you previously use vaping products?
No.
Okay. Do you currently use marijuana or THC products?
No.
And do you use or misuse substances that are not prescribed by a doctor?
No.
Okay, thank you. Now we'll proceed into the demographic information section. Can you please share your sex? The options include male, female, female to male or unknown or other.
Male.
Thank you. And how would you describe your race? You can select multiple options, including American Indian or Alaskan Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, white, other, prefer not to answer, or unknown.
Prefer not to answer.
Okay, and are you of Hispanic, Latino, or Spanish origin?
No, I'm not.
Okay, thanks. In this next section, we'll talk about where you work, go to school, or volunteer. In the 14 days prior to your illness, or at any time since then, did you work or volunteer outside of your home?
No, I did not.
Okay, sounds good. And as a note for the video, if the person had indeed worked or volunteered in this time period, we would ask questions about their job, their employer, the address and location of their workplace, including if they work at multiple locations for the same job, we could specify that here. We'd ask about the last date that they worked outside of the home and any work while experiencing symptoms, as well as specifics about being a student or childcare attendee. But here, because Josh has not worked outside of the home during this period, we will be able to skip this section. And next, this travel information section, we will only see in the full interview, whereas we would not see it in the brief interview. But since we're conducting a full interview here, I'll go ahead and ask these questions. So back to the call with Josh. Josh, now I'd like to ask you about travel during the 2 weeks prior to your onset of symptoms or at any time since you became ill or tested positive. Did you do any travel during this time period, or did you stay within your county of residence?
I stayed within my county.
Okay, thank you. So in that case, I won't need to ask you any additional details about the travel. There are some living conditions that can increase the risk for transmission. I would like to ask you a few questions about this so that we can determine if you were exposed to COVID-19 in a high-risk setting. During the 2 weeks prior to symptom onset or at any time since becoming ill or testing positive if you didn't have symptoms, but I guess just since you had your symptoms, were you living or working in any group setting other than a private residence with multiple household members? For example, a group home, long-term care facility, migrant worker housing, rehab or addiction treatment setting, or any other setting where people live in close quarters?
No,
Okay, and were you in a correctional facility in the 2 weeks prior to symptom onset or since then?
no,
And are you currently experiencing homelessness, or were you experiencing homelessness while you were ill or during the 2 weeks prior?
no.
Okay, and how many people are in your household, including yourself? So household members are people you live with some or most of the time, such as roommates, family, or others who would share sleeping, bathroom, and kitchen eating areas.
One.
One, so just you?
Yes.
Okay, thank you. Next, I'd like to ask you some questions from the 2 weeks prior to symptom onset or at any time since you became ill. Would you be willing to look at your calendar, phone, or social media to help jog your memory about what you did and who you had contact with?
Yes.
Did you visit a healthcare setting as a patient, but not for this illness?
No.
Did you visit a healthcare setting for any reason other than as a patient, such as going to someone else's appointment?
No.
Okay, were there any other healthcare settings you were involved in?
No.
Okay. As far as you are aware, did you have contact with anyone with confirmed or suspected COVID-19?
Not that I'm aware.
Okay. And have you been self-quarantining due to a known or suspected exposure?
I have not.
Okay. Do you know if there's any chance you would have had exposure where there may have been a cluster or outbreak of cases? It's also okay if you're not sure.
I'm not sure.
Okay. Great. And so now for the interviewer, you'd also want to check the vaccination status and ask the following questions if no vaccination information is available. Otherwise, we could skip some of the questions below. Okay, in the last 5 days, did you spend any time with someone who is at high risk or in a high risk setting?
No, I did not.
Okay, thanks. And so now I'd like you to walk me through what you did each day from the period 2 weeks prior to symptom onset or at any time since becoming ill. And here I would, as the interviewer, you can see there are various options for the type of activity, and whether we want to add more. So this could potentially add up to be many activities depending on how out and about the case was during that time period. For the sake of this video, I'm going to skip past this portion and ask about the COVID vaccines. So Josh, have you ever received a COVID-19 vaccine?
Yes.
Okay, thank you. And how many doses or shots have you received?
Just one.
Just one, okay. And now I'd like to know, do you know the date that you received that shot?
It was yesterday.
Yesterday, okay. Wow, lots going on yesterday. And do you happen to know the details of the vaccine type?
I know that it was Pfizer. Is that what
Okay.
you're asking?
Sure. So the vaccine manufacturer was Pfizer. That's great. And so as a note for the video separate from the phone call, some of this information might auto-populate depending on information from the record. For example, maybe we're pulling in data from their medical chart and we would see a lot number already available here because sometimes the case would not know this information themselves. Okay, now back to the call with Josh. So Josh, thank you so much for taking the time to go through all of this with me. Now I just want to be sure you have the information you need so that you and those around you can stay safe. Anybody who is sick or tests positive for COVID needs to be isolated, even if you have been fully vaccinated or are up to date on recommended vaccine doses, including third booster doses. So it's very important that you follow these instructions. So Isolation can mean we are asking you to stay home for a long time. Do you have any concerns about staying home during the isolation period?
No, I don't.
Okay. And so now, since you're a symptomatic case, it's important to stay home for at least 5 full days after your symptoms started. And if you don't have symptoms anymore, or you have symptoms that are improving and you do not have a fever, you may leave isolation after 5 days, but should continue to wear a well-fitted mask around others at home and in public for 5 additional days. And there's some more information you would share when conducting this, but the details are here. So you just read that out as the interviewer, including a lot of this information down here, which has been recently updated. And we can also share these details about how to isolate. And so Josh, per CDC guidelines, your isolation period includes after the 5th full day after your symptoms started, which means you're able to return to your regular schedule on day 6, not before if you don't have symptoms or you had symptoms that are improving. So your isolation start date began yesterday. So your end date will be May 1st, and you must isolate through the end of this date, as well as then continue to wear a mask and not travel through 5 days after that. So that's May 6th.
Okay.
And as the interviewer, you could have the potential to override the existing isolation start and end dates. But here the information we have is accurate, so we'll maintain those guidelines. So Josh, I would like to share a copy of these instructions along with other important information with you to help keep you and those around you safe. It is usually easiest to share this information with you via email. Do you agree to allow us to send this information by email?
Yes.
Okay, great. So now I've shared that, and is joshblue@email.com the email you'd like for us to send the notice to?
Yes, please.
Okay. And as a note for the video, you can also include a personalized note to appear in the email so that we'll see that if there are any details you want to remember or any message you want to share. And so we'll presume I've read out those isolation instructions above and I've sent them on to Josh. So now back to the call. Thank you for staying with me. I know it's a long survey, but we are almost done. I'd like to work with you to identify who you may have had close contact with and provide you with important information to share with them. And our team can follow up with them. There's a lot more detail here that we would read in the full interview, but for now, I'm going to proceed to the question to ask Josh. So Josh, are you willing to stay on the line in order to register contacts that would benefit from public health follow-up?
Yes.
Okay, thank you. Thank you for participating in this program and helping to stop the spread. So I would then be able to fill in these remaining fields and go to the register contacts form to ask Josh for that information. Since this video is just going to focus on the case investigation form, I will close our call with Josh now because this is something that I can just fill out as the interviewer. So Josh, thank you so much for your time today. I appreciate all of your thoughtful answers. We will be in touch, but that's it for today. Thank you so much.
Thank you so much.
All right, so now we just go ahead and finish up the case investigation form. We completed the interview in English. We did not need an interpreter or cultural navigator. It was me, which will auto-populate, who completed this, and I conducted an interview. I did not have any epi concerns, and the transmission type, we're not sure exactly yet. We could also just not fill this out if we're not sure. And importantly, we need to confirm the patient's outcome or final disposition. So we have asked all the full interview questions that we needed. So we have completed the interview. And we have some more questions about supervisor review. We could also close the record if needed. But here, let's review what we have here. It's important to go to this review tab because you can see if any fields are missing that are required for the record to flow to CDERS. So for example, we would need to fill in this property and get that information from them in order to have this actually flow back to CDERS. So perhaps before ending the call, it could be good to check down here. And we also see some lab results information that we need to add. So then at the end of the form, we can go to the register contacts form, especially if we're keeping them on the line. We'll quickly go there and ask them information about their contacts. Otherwise, we can just take ourselves back to the menus. But you can see we're missing a required question. So we can click here or on this next arrow button and next arrow, and it will take us back up here. to this required question about the outcome. So we have actually completed the interview, so I'm able to select this, but of course, if we were only able to leave a message or send an email, we could add that information there. So now we are able to go ahead and submit this case investigation form with a lot of helpful information that we've gathered through the interview about Josh Blue. Thank you for watching. For additional support, you can visit the website linked in the slide.